So finally today, the last kind of job of the day really is that I'd like to hand you over to my colleague Dr. Anne Costello, who's a program manager for the National Research Ethics Committee for the National Irish COVID Biobank. And Anne is going to just sum up some of the key points and discussion points that we heard today. So Anne, I'll hand over to you.
Thanks, Emily. It's been really great today to listen to all of our fantastic contributors. There's a few main messages that have really come through strongly throughout today's discussions. So I'll attempt to summarize them quickly. So Emily, you gave a great overview of the journey of the National Office since its inception, really focusing in on, the strategic priorities and the overall mission of the office to embed a robust and transparent and cohesive research ethics review system. The snapshot that you gave there of the committees was eye-opening, and their clear dedication to the ethical priorities and legislation really came across. So we had then Anne-Marie Seymour from the Department of Health, who really drove home the need for centralisation and coordination of research ethics opinions, a national voice, basically. I think one of the key points that came across here is the work of the NRECs is based in legislation, and the committees provide a national ethical opinion in line with national and EU regulations, which is really important. She mentioned the NREC bill, and which will strengthen the legislative landscape in Ireland, and also she mentioned the Irish COVID-19 the National Irish COVID-19 Biobank, upcoming legislation on ionising radiation, and the National Genetics and Genomics Strategy, and a number of other items which are in the pipeline, overall leading to a requirement, I think, that came out for an expansion of a national system for ethics review. So thanks, Anne-Marie, for that. Sue and Lucia's session really highlighted the great work being done by the NRECs and by each individual committee member, as well as the huge amount of operational management behind the scenes at the National Office. It was great to actually see the numbers of applications and the amendment requests that have come through the CT and the MD NRECs, and the sharp uptick in decisions issued from last year to this year was eye-opening. In saying that, we know that the implementation of the CTR is just around the corner, and it's clear that the office is really well prepared for it, which is great. Our keynote speaker then, Professor David Archer, touched on the general heterogeneity in the bioethics systems across the board between different types of committees involving research ethics, clinical ethics, advisory boards, for example, and he very diplomatically, I thought, used the term plurality of advice from different sources. He zoomed in on the importance of a system which ensures consistency of advice. It was really interesting to know that no field is carrying out a mapping exercise of the bioethics system. And what really came through here, perhaps, is the answer to ensuring consistency appears to be regulation, proper regulation in the context of rapid scientific progress and national ethics systems. With the example here that he had made of national ethics systems of France and Germany, which have worked really well. David also talked about ethical preparedness, a concept prompted by the pandemic, and how different countries have responded to the ethical challenges of COVID. His talk really highlighted a need for an authoritative and clear ethical guidance at a national level. The panel session then threw up some really interesting points on some of those emerging topics. We talked about AI research, potentially poorly equipped in terms of research ethics committees. The ethical challenges are quite large there, and the skepticism isn't important because we need to be ready for really fast-moving research. We talked then about the requirement to be able to pivot rapidly to support infrastructure such as genetics and genomics, the legislation that's coming through. We talked about platform trials, and really importantly, we talked about the research ethics associated with the ageing population, the importance of involving ageing participants in research and in ethics decisions, and generally the importance of engaging advocates for vulnerable groups, to address poor health outcomes and marginalised groups, which was really highlighted by the COVID-19 pandemic. So finally, then, the importance of PPI came through really strongly. It's something that we're all very, very aware of. And we know that it helps and is very important, both in research development and in the generation of ethics opinions. So finally, then, it's really important that what came across is to nurture an ethical mindset in the system and a harmonized approach to ethics, which really came through. So with that, I'll pass back over to Emily, who's going to give some closing words.
And thank you very much. You really summed it up fantastically. So thank you for that. I don't have much more to say, really, just to thank you all for joining us. I think we've had an excellent morning, and a sincere thanks to the HRB and especially the comms team and Anna Dunn, who helped effectively produce this entire webinar. So that's really appreciated. Thank you to our committee members, all 68 of you, including the COVID-19 subcommittee, for your diligence, your commitment to enabling us to have a national ethics system, and we will aim to build on that going forward. So we thank you for that. And lastly, we hope to see you next year again in person, where we aim to have an in-person, more broader ethics symposium in 2023. So we always welcome your feedback from the community, from all our stakeholders, and we look forward to seeing you then. So thank you, and enjoy the rest of the day.